This short video summarizes the Denver 2 developmental screening test used by physical therapists. Our objectives are that by the end of the video, the student will be able to calculate chronological age. The student will be able to administer at least 4 different items on the Denver assessment, and the student will be able to identify the role of the Denver in screening a pediatric population. The Denver 2 is used to assess developmental progress in children from birth until age 6. It has 4 components: personal social, fine motor adaptive, language, and gross motor. The materials needed are available in the lab. The Denver 2 is a norm reference test, meaning that this test may help identify if a child is having a delay in one of these areas compared to the rest of the population. In the following videos, we will give you examples of what each of these sections include and what it looks like to perform with a child. The first important step when using the Denver 2 is determining the child's chronological age. Chronological age is important to determine in order to get an accurate reading as to if the child is delayed or not. Chronological age must be adjusted if a child is under 2 and has 2 or more weeks prematurity. Let's walk through an example. First, you would use the date of the exam, starting with the year followed by the month and then the day. On the next line, you would put the child's birth date in that same order. Subtract the birth date from the date of the screening. Let's go through the calculation. To subtract 30 days from 1, you need to borrow a month from the second column. That turns 7 months into 6 and 1 day into 31 days. Remember that for every month you borrow, you are adding 30 days. In this example, we did not need to adjust for prematurity because the child was over 2 years old. Now let's discuss the 4 components of the Denver 2. The first component is personal social component, which includes tasks that involve naming friends, the ability to put on clothes, and if the child is able to self-groom. This section can be administered by asking the parents or guardians if the child can perform these tasks at home. This is the only section where you can ask the parents questions. The rest of the sections you need to see the child perform the task. The second component is fine motor adaptive. This section includes hand-eye coordination tasks such as drawing a person or copying objects. Next is a clip of the child performing these tasks.
Can you copy that? Good job. Can you copy that one? Can you name what's on your person? What did you draw? What is this?
Circle.
What's it? What is this on the person?
Face. Eyes, nose, and mouth.
This is a screenshot of the picture the child copied and of her person. A greater number of body parts identified will result in higher scores. The third component is language. This section includes, for younger children, seeing if they know any words at all, and for older children, seeing if they understand objects and the meanings of different adjectives and adverbs.
What is a house?
A house is something you live in.
What is a banana?
A banana is something you eat.
What is a curtain?
A curtain is something to cover you if you don't want anyone to see you.
What is a fence?
A fence is something that separates your houses from your backyard.
What is a ceiling?
Ceiling is like that.
If a horse is big, what is a mouse?
Small.
If fire is hot, ice is
Cold.
If the sun shines during the day, the moon shines when?
Night.
The last component is gross motor. This section looks at if the child is able to perform gross motor tasks such as walking, jumping, running, etc. This section correlates with the gross motor development milestones that a child should be reaching by their
Can you
age.
jump over the piece of paper? Heel to toe. Hands on your hips. Can you do it with hands on your hips?
No.
Okay.
I need my arms out.
Can you hop?
Working with a child can be fun and challenging. Remember that when working with children, you need to be flexible and patient. A child can be easily distracted and may not want to perform the tasks that you want them to. This following clip is an example of how children can be adorable and yet easily distracted.
Where's that pencil?
Hold on. Okay, is a house big?
Yes.
In this video, we learned about the Denver 2, a pediatric screening test. We learned that this test can be given to children ages birth to 6 years old, and that there are 4 components. We also learned how to calculate chronological age. Remember that the Denver 2 is a norm reference test, so it can help us determine if a child does or doesn't have a developmental delay. If you suspect that a child does have a developmental delay after performing this test, refer them back to a physician for further testing.